So we've heard a lot of different answers to some of the specific questions we referenced early on. So let me summarize and finish up, and then we'll take some questions. But how do we move then from the current state that we talked about that is fragmented, that's highly variable as it relates to quality and safety and equity, and that's maybe not as supportive of patients and individuals and even provider concerns, and is fraught with unsustainable cost in today's world, to the new world and future state, which is seamless and coordinated, has high quality, timely, equitable, safe, accessible, affordable care, that's truly person, family, and community centered, and also is supportive of providers of care themselves. Remember that quadruple aim framework. And so what we've heard today, if you move to the next slide, is really how an all-payer claims database can be used by many different stakeholders, whether it's physicians or employers or community entities, private companies, academic institutions, policy researchers, and how, in fact, it can be applied and used. And there really starts to become an unlimited number of things that we might be able to look at that give us insight into not only the individuals, but the whole population with an all-payer claims database. And I heard the term mentioned of a single source of truth. And it can be a single source of truth. But as I said, also we need to remember that it is a foundational data set, meaning it's a place to begin and something that we can build upon and flesh out to even greater levels of granularity as we move forward. So if we go to the next slide, one of the things that I think is, for me, very helpful, if I'm trying to keep something top of mind, which is what we're trying to do here, is to have some mantra about that. And so I'd like to share with you my mantra for how to keep the value of this top of mind. And the first is, let's not make assumptions, let's not make decisions then based on assumptions that we don't validate with data. Too many times that happens. Let's move from proprietary silos to complete transparency. We live in a world today in healthcare that's very opaque. We have a lot of black boxes. You've heard that term used. How do we move away from that? And lastly, how do we move the meter? How do we actually quantify results and understand where the actions can be taken and what the result of those actions are, and continue that in a continuous improvement process? So I want to finish up and moving to the next slide with a question for all those on the webinar today. And that is this question. Do you believe, as we do, that data is the lifeblood for improvement? Data is the lifeblood for improvement. So if you believe that, then what do we do when we have something this valuable? And I would propose that there are at least 5 things we would do with something that valuable. Number one, we would retain it. We don't want to lose it. Second, we would refresh it continuously. Third, we would protect it at all costs. And fourth, we would use it because our very vitality depends upon it. And lastly, as I think it's very pertinent to our discussion around an all-payer claims database, is we would share it widely and not hold it in some black box somewhere, but actually share it widely so that we can see that whole picture we talked about. So an all-payer claims database is the foundation. It is a wonderful resource that can be the single source of truth for us and be the very lifeblood for improvement in Kentuckians. I'll finish up with a slide and a quote that I like a lot, and it was stated by Abraham Lincoln. And so as we think about how to move to the future, the best way to predict your future is to create it. And so let's create the All Payer Claims database together as a foundational resource for Kentuckians.